Good afternoon and welcome to our daily media briefing. I hope everyone had a very happy Mother's Day on Sunday. And we are going to be giving you a lot of information today in regards to the charts and graphs, but we really wanted to appreciate everyone making adjustments to their Mother's Day celebrations, whether it be through social distancing or through wearing facial coverings. We know some family members were not able to visit their mothers due to safety precautions, and we greatly appreciate your sacrifice and commend you for taking that extra step. Because it's been a couple of days since we last met, I'm going to be brief so we can get to the updates. But I do want to remind everyone that May is Mental Health Month. This week, our County Administration Center will be lit up in green to raise awareness of mental health. The last few weeks have been difficult on everyone, so please remember that if you need assistance, our County Behavioral Health Services offers plenty of resources on our website. If you need support or are actively seeking services, please call the Access Crisis Center at 888-724-7240, and an experienced counselor will provide you with a referral to meet your needs and help determine eligibility. And of course, you can always dial 211 to get connected to a variety of resources. So don't wait. Call now if you need help. With that, please welcome Supervisor Nathan Fletcher.
Thank you, and good afternoon. As we start our week, I think it is important for us to continue to reiterate and remind ourselves that the best way that we move forward into this new phase, the phase of adaptation, it is important that we do it together. We certainly understand that there is frustration and anxiety and concern and a desire to get everything back up and running, and we would like to do that as well. It's just vitally important that we do it in a way that allows for a sustained recovery. We do it in a way that not only protects public health, but also protects a smooth economic recovery. The best way for us to come out of this is together. As a community, we went into dealing with this crisis together, and we saw incredible results. We've been held up as a model for success in terms of our ability to flatten the curve, expand our health system capacity, get in place greater capacity for testing, tracing, and treatment. And as we come out of it, we need that same spirit to remain with us, that we are doing this together. On Friday in San Diego County, we opened up a significant portion of our economy, large segments of retail, manufacture, warehouse, supply, and logistics. And that is on top of the essential businesses that have been open throughout the duration of this. The state of California estimates we now have 70% of our economy currently open, some with modifications, but at least being open and being back in business. While there is still more to go, another 30%, and many of those are critical components of our life and our economy and what we do. But as we continue to move forward, we are going to have to continue to do it in that same spirit, under the guidance of the Safe Reopening Plan that's been put out, and in a thoughtful way that ensures that we can take a step, be able to measure the impacts, what is happening, allow time for folks to get into new habits, but most importantly, that we do it in an effort that continues to move us forward. Just like we are moving forward as a region in terms of opening our economy, we've moved forward in opening other types of opportunities, opening our beaches a little more, our parks, our outdoor recreation, camping, boating, and other types of things. And we stand before you today saying we believe that we are doing it in the right way. We believe we are doing it in a responsible manner. And so we want to continue that same spirit to make sure we're protecting public health, we're protecting a smooth economy. I do want to address the issue because, again, there seems to be some lingering concern over the issue of local variants or local counties' ability to move separate from the state. The governor made clear again today that the entire state of California will continue down a path of reopening. We saw that last week. He's alluded to the fact there could be more business sectors that are opened this week. That is what we are operating under, and that's the path we want to stay on. Some counties are choosing, because of the conditions on the ground, to move slower than the state of California. Some Bay Area counties have not yet instituted the retail openings that we did last week. Some of them are just now bringing online construction, something that we never stopped here in San Diego County. But every county has the ability to move slower in a more restrictive fashion than the state. We have not done that as a county because our facts and numbers and conditions on the ground do not warrant that. There are a handful of counties that meet the threshold to move much faster than the state. Those are primarily rural counties. They are much smaller counties. They are in a much different situation. In order to have that flexibility and freedom, not only is it the number of deaths, but there are a variety of factors that have to be met, including every hospital system signing off that they concur with the decision. That is an unlikely scenario as it presently stands for San Diego County, but that does not stop us from continuing to move forward in stage 2 with the state of California. And so we took a huge step forward last week. We expect more steps to be moved forward this week. And so we will continue that all together as a region, awaiting any changes for what may happen. And so, again, tremendous progress over the past few weeks. That progress to date continues to demonstrate the numbers we are doing well, and we need that to continue. The only thing at this point that would significantly slow us down would be a change in our conditions, and a change in our conditions would be brought on by a change in our mindset and our commitment and our posture. And we know that if we stay together, if we follow the orders, if we look out for one another, and if we adapt our actions, we can continue to be a model for our region. Over the weekend, I participated in an announcement with the YMCA of San Diego County. In summertime, when schools are out, they are the single largest provider of child care services. We know that you cannot begin to reopen an economy and expect parents to go back to work if there are no options for child care. And so I was pleased to stand with the YMCA as they announced the opening and beginning process of opening their summer camps. They're going to do it responsibly. They're adhering to the public health orders. They're going to do it in a way that protects as best you can the public health of both their workers and our children. But this is a significant step forward, and I want to say a special thank you to the San Diego Foundation for taking $1 million out of the Community Response Fund and donating it to the YMCA Summer Camp Program to aid and assist in providing vouchers and scholarships for low-income families, and also to assist in their startup costs. We know that there will need to be more work and effort around child care as we begin to get more sections of our economy going, but this is certainly a step in the right direction. We're going to get to testing in a minute, and I just want to let you know there was considerable energy and effort over the weekend around issues of testing, both on issues of supply chain and personnel protocols, working with the state to ensure we get expedited on shipments of vital components we need to execute on our testing. And we are in a period of uptick. We are in a period of stepping up what we are doing related to testing. If you go back, in late April was the first time we saw 4 consecutive days with 2,000 tests conducted per day. That was the first time throughout the duration of this that happened. If you go to last week, it'll be the first time you saw 4 consecutive days of 3,000 or more tests conducted. Again, we are stepping up. We want to see that go into the 4,000 range, the 5,000 range where our present goal is, and then continue to go beyond. Today, our numbers are down a little bit. On Saturday, we reported 3,401 tests conducted. Sunday, we reported 3,443 tests conducted. Today, we're only reporting 2,638. Sundays are always a little bit of a dip. The drive-up testing for the state is not operational on Sundays, and apparently a lot of folks do not want to spend their Mother's Day going to get a test. But Mondays have always been a little bit low historic, but we believe that we are on the right trajectory, and we want to continue to do that. I also wanted to share issues of face covering and broad spread compliance. We are hoping, as this has been socialized and worked around, that folks will understand the vital role face coverings play in a recovery. We've done a lot of things in providing face coverings to law enforcement to be able to distribute as a part of an education, a very soft form of enforcement as we strive to continue to try and get widespread adherence. We are also working with the Metropolitan Transit System and MTS on providing some face coverings to them that can be made available to individuals who are utilizing the MTS system. And we will keep looking for creative ways to make it easier for individuals to obtain a face covering and provide, again, a soft form of enforcement to try and get wider spread adoption. On the subject of MTS, I would just like to take a moment and send our deepest condolences to the family of the CEO of the Metropolitan Transit System, Paul Jablonski. Paul passed away unexpectedly yesterday. He was a great leader for our community, a very committed public servant. He ran a great agency, and he was someone who certainly grew on me personally over the time that I worked with him as chair of that agency. And so to Debbie and her family and everyone out there and all the staff at MTS, we send our deepest condolences on the untimely death of Paul Jablonski, and he will certainly be remembered. Now we'll go into our T3 chart. Here you can see we did 2,638 tests, which I just mentioned. We're over 82,000 cumulative tests. We continue the process of backgrounding and beginning the training, onboarding type efforts around our contact tracers and investigations performed continues to go up. We presently have 197 individuals in our public health motel rooms, 643 cumulative. Today, we are reporting 139 new positive tests. Again, this is out of the total we reported of 2,638. You can see right there, which is 5%, and I want to reiterate, we say this every day, the number of positives is less significant. It's actually not that significant at all. It is relative to the total number of tests being done. And you can see the overall downward trajectory of the percentage of positives. We believe as we continue to increase testing and we begin testing a wider variety of folks, we expect this number to continue to trend downward or hold flat and steady. But again, you can see the 4 days there, over 3,000 tests a day we alluded to. This is a stepping up, and we will have variation days here and there, but on the whole, we're headed in the right trajectory. We want to get there. We want to get there fast, and we will continue to work on those efforts. Likewise, in our hospital daily census of COVID-related folks, you see in the orange there, the COVID-related ICUs, 142, basically holding steady and flat over the course of the last week. Again, we explained last week there was a little uptick here when some new hospitals came online and started reporting. Nothing alarming in that. And then the total there at 390. That is both ICUs and non-ICUs that are COVID-related. The next one, again, tracks our total hospital capacity and utilization. This is both COVID-related patients in orange and non-COVID-related hospital patients in the blue that you see right there. And again, generally very flat. Our final chart is just our cumulatives. You see we're over 5,000 cumulative positives as a region, almost 3,000 estimated recovery, cumulative hospitalizations with a doubling rate of every 37 days, cumulative ICUs with a doubling rate of every 54 days, and then the unfortunate loss of life there at the bottom. That concludes my section of the report. Next, I want to turn over to Dr. Wilma Wooten for a Public Health Officer's report.
Thank you, Supervisor Fletcher, and thank you to everyone who's attending today's media briefing. Today's statistics for COVID-19, as has already been shared with the overall summary of the numbers, continues to increase, and this is due to our increasing testing. The global, national, and state statistics based on data from Johns Hopkins dashboard that was obtained today at about noon are as follows. Globally, there are over 4 million, actually 4.1 million, positive cases, including over 284,000 deaths. The United States is reporting approximately 1.3 million positive cases, including 79,000, almost 80,000 deaths. California is reporting approximately 68,000 positive cases, including 2,719 deaths. And today, the County of San Diego is reporting 5,065 cases, which is a milestone for us, which is 139 more cases than yesterday, as well as 175 deaths, with no new deaths reported since Friday. Of the total number of overall cases, the age range now is 3 months to 101 years of age. 52% is the number of, or rather the percentage of individuals between the ages of 20 and 49 years of age of the total number of cases. 49% of the total number of cases are female and 51% are male. 973 or 19% of the cases have been hospitalized, and 302 of this number have been admitted to the ICU. The 175 deaths represent approximately 3.5% of the total number of cases. Also, of the 175 deaths, 43% were female, 57% were males, and regarding the race and ethnicity, We have that data for 91% of the 175 total number of deaths. As a reminder, all of our demographic information is found on the county's website. Lastly, regarding outbreaks in congregate and community settings, today we are reporting a cumulative total of 63 confirmed active outbreaks reported since yesterday. Of these active outbreaks, 41 are in congregate facilities, which includes 1,144 cases and 89 deaths, and 22 active outbreaks are in community setting locations. And cumulatively, this is 232 cases and 5 deaths. And we continue to monitor metrics that are currently trending in the right direction, and this is because of the help from individual residents, from governments, organizations, and businesses across the county of San Diego. So now please welcome back to the podium Chairman Greg Cox.
Okay, we'll get right into the questions. Again, please identify yourself by name and outlet if you're not introduced by the call-in clerk. Let's go to the first question.
Melissa Macia from 10 News, please state your question.
Hi, Supervisor. I actually have a two-part question. First part, we are getting complaints from businesses about what they're calling uneven enforcement of the rules. Some businesses get excited, others are not. I was looking for a response to that. And then secondly, we're also hearing about growing frustration from true small business owners with maybe only a few employees, in that if they are able to enact social distancing guidelines, et cetera, why are they not able to open yet? Big box stores remain open.
Okay, Supervisor Fletcher is going to answer at least the first part of that.
Thank you. As it relates to enforcement, that is at the discretion of the appropriate local law enforcement agency, whether that's a local police department or in the unincorporated or contract areas, the sheriff's department. And so again, any questions related to enforcement would best be directed to those agencies, and they can comment on their posture and what they're doing, along with any specifics, questions you may have. As it relates to the frustration, the step that we took forward as it related to retail being able to open did not have a threshold of small versus large. It just simply applied to all retail in those sectors and segments that are able to do delivery or curbside. And so those are able to open, and there's nothing in the essential business or in the new one that outlines what size a business. It is more based on the category of that business. And so we would just encourage folks to responsibly follow the orders that have been put out, fill out your safe reopening plan if you're in the categories of either essential businesses or the newly reopened businesses, and move forward responsibly.
Okay, let's go to the next question.
Marilee Moore with Fox 5, please state your question.
Hi, yes. Well, multiple casinos in the county, they've expressed their plans to begin phase reopening starting on May 18th. Looking to get your response on that.
Okay, Supervisor Fletcher.
Yeah, as it relates to their announcements or their plans, that really is a question better directed to the state of California, as it is their order, and it is also their authority that oversees those entities. So we would direct you to the governor's office on that.
Okay, next question.
Matt Hoffman with KPBS, please state your question.
Hi, I was wondering, what would you say to business owners who are stressing right now, and some, in the case of a gym owner up in Oceanside, are reopening and facing penalties for it because they say they just can't wait any longer?
Okay. I think Supervisor Fletcher is going to respond.
Look, I understand their frustration. I understand the challenges that our businesses face in this time of difficulty. And all we can say to those individuals and those companies, those entities, is we want everyone to be up and running as soon as possible. But in order to do that, we have to see continued progress in the metrics, in the cases, in the hospitalizations, and the symptoms, in each of those things. And we have to continue to follow the guidance of the state of California. And as we move forward, it does make logical sense that we would start with those entities that have the lowest risk, that have the lowest intensity, the lowest duration, the lowest concentration of individuals, and begin to do those first as we move through those. And some of those entities that are going to be on the back end of that, whether those be conventions or movie theaters or large gatherings or perhaps even gym facilities, it is going to be much harder on them to move forward as a region. But we ask for the public's continued help, because the worst thing we could do as a region is have too many folks open too quickly, create a surge and a huge uptick in what we're doing, and then be in the really devastating situation of having to reimpose or reclose things. And so we want our recovery to be smooth. We know individuals are struggling. We've seen a lot of efforts around trying to help small businesses, certainly a lot of efforts around both unemployment insurance along with pandemic unemployment assistance, the federal aid on top of that. And so we know individuals are struggling and hurting, and we're trying to do this in coordination with the state as responsibly as we can and as quickly as the situation allows.
And then to follow up on that, Councilmember Christopher Rodriguez of Oceanside is telling business owners there that they can reopen if they feel comfortable. But the mayor said that he obviously doesn't have the authority as a council member to do that. But he says that the county and state started this whole thing with a plan, and now that plan will only end with businesses closing. Just if you could respond to him and his telling businesses that they can reopen in Oceanside.
Well, I think in Oceanside, cooler heads prevailed. I think that was the mayor and the law enforcement both made clear what the public health orders are. And again, we understand people's frustration, but it is important that as we go through this, we do it mindful of the public health orders that have been issued are out of a desire to protect life. And as we come out of them, it's out of a desire not only to protect life, but to protect the economic recovery, to ensure that we do it in a responsible way. So we understand the frustration, we understand the anxiety, we understand the where Oceanside would like to be as a city, but we have to follow the system in place that we have. And so, you know, we appreciate the mayor as reluctantly as he had to, basically clarifying that is not the position of the city of Oceanside. We appreciate law enforcement doing the same, and we want everyone to know that we're gonna get to an opening and continued opening as quickly as possible in a responsible way, and we ask everyone to just hold strong with us as we work through this.
Next question.
Brandon Lewis, CBS 8. Please state your question.
Yeah, my question is about short-term vacation rentals and hotels. We've heard from some viewers who complained about large gatherings at rental properties along the beach in the city of San Diego. Certainly gatherings are allowed under the health order, but I'm trying to understand the rules about lodging and why, according to Airbnb and the State Hotel Lodging Association, there aren't any local restrictions like some other counties and cities that limit them from leasing to anyone other than essential workers.
Okay, Dr. Wooten's going to respond.
So thank you for that question. Airbnb, the use of Airbnb is only lawful if it is being used for essential workers. So currently, at this point in time, in stage 1, and now we are in stage 2, there is 0 gatherings for the general public. So people, friends gathering at Airbnbs for parties or whatever is unlawful. So if anyone is aware of such activity, it should be reported to law enforcement via 211 or calling the non-emergency law enforcement line to report those activities. And hearing about this now, we will also write a letter to Airbnb to make them aware of the fact that this is going on, and hopefully they can help us with this as well. Thank you.
Okay, let's go on to the next question.
Alexis Rivas, NBC 7. Please state your question.
And so Mayor Kevin Faulconer tweeted out a letter to the governor basically calling these metrics to reopen unrealistic. and saying it's going to drive up the unemployment rate, just sort of urging Governor Newsom to change those metrics. And I'm just curious, where does the county stand on that? Are these metrics to reopen from the state unrealistic for the county of San Diego?
Well, since I think that's the letter that I co-signed, I'll try to respond to that. Our goal is to encourage the governor to look at each county. The county of San Diego, we think, has been very responsible in the way that we've implemented his executive orders. Obviously, all counties want to get back open as quickly as we can. We hope you'll take a look at the plan that the Recover Task Force has just recently completed. Take a look at what the county of San Diego has laid out there, and maybe take another look at what he indicated last week, that you'd have to go at least 2 weeks without any deaths before businesses could reopen. In my opinion, and I'll just speak for myself, I think that's an unrealistic standard that any large urban county probably could never meet that for the foreseeable future. And so we hope he'll take a look at that and reconsider. We know that he's going to be making some more announcements this week, and perhaps that'll be included in his future announcements. Thank you. Next question.
Mark Ziegler, Union Tribune, please state your question.
Yes, I had a question about chlorinated swimming pools. The CDC has said there's, quote, no evidence that the virus can be spread, unquote, in chlorinated pools. Riverside County recently issued guidelines for the use of community pools. Mission Viejo has opened one of its city-owned pools for lap swimming. And you have opened or relaxed restrictions on numerous recreational activities, some of which arguably might not be as safe or don't have the similar endorsement of the CDC. Why aren't pools being opened, particularly just for lap swimming without locker rooms, just the actual pool facility itself?
Okay, Dr. Witten will respond.
Supervisor Fletcher made a comment earlier about intensity and duration, and that basically is, it's looking at the risk of transmission of COVID-19 based on the intensity, how many people are involved, and also on the duration, how long would an entity be in a particular business. And you can, and actually this is part of the federal roadmap for businesses getting back online. So I would encourage everyone to take a look at that. Pools are not currently in stage 2. I believe they may be in stage 3. So they're not in our current. Right now, the primary focus is on retail and any manufacturers or supply chains that support that retail. So that's the reason that pools are not in stage 2, because individuals coming together, if they're not household members, it just increases the risk for transmission when you bring, and this is about gathering. And again, to remind everyone, we are at 0 gatherings for our health officer's order at this time, and we are doing that in accordance with the state.
As a follow-up on that, my understanding is that several local pools, not city-owned pools, but other local pools have submitted applications to open to the county. Can you confirm that that's happened, and if you denied them, and whether you denied them or not, and maybe how soon you think this could happen?
So we've asked many businesses to develop their plan and submit to us, but we have not given the go-ahead or the authority for pools to be in operation. So right now, again, the only entities that are in operation, we are continuing essential businesses, everything that was in place for stage 1, and in this California stage 2, we are now opening up retail businesses for curbside only, not even for people to go inside the business. So it's just curbside. So you can imagine this is a metered approach, because we do not want to lose any gains that we've made so far. So going slowly is what we're doing. And that is from guidance from the state, and we are in agreement with that.
Thank you.
Okay, and Dr. Wooten, I have a question from Bridget Naso at NBC7. With more businesses reopening and people out, it is noticeable a good number of people may have a mask but do not put it on when they come within 6 feet of someone. Is this policy to have a mask with you but not to necessarily have to wear it good policy when a good portion of people are not putting those masks on when they come into contact with people?
So just want to remind the general public that the guidance and the health officer's order right now states that individuals 2 years of age and older, when they are out in public, should utilize face coverings if they are within 6 feet of individuals. And we recognize that not everyone is doing that just yet, but we hope that a large number of individuals are, and we want to continue to encourage those that are not to do so, because it really does help to decrease the spread. We now know that individuals can have no symptoms and be positive because they are positive for coronavirus without any symptoms. And we have proven that in testing various populations throughout San Diego. So it is imperative that when people go out in public and when they are within 6 feet, or as they are approaching others, that they have that 6 feet of separation as well as using the mask, or facial covering, I should say, because masks, surgical masks, and N95 respirators are reserved for our healthcare providers.
And Dr. Wooten, I have a question from Paul Sisson. Is the positive test rate increasing or decreasing in the South Bay? And has the county heard of any additional assistance coming as requested from the federal government?
Well, in terms of decreasing, we are in the process of trying to look at the positivity by region. But as you have seen here today, overall, we see that number decreasing. In terms of support, we are getting support from the state. Have not heard of any specific support from the federal government. If we do well with testing with the drive-through sites that we have that are provided to us, the resources are provided from the state, we have the potential to expand that. So that's why it's very important that when people make their appointments, that they keep their appointments so that we can utilize all of those spaces to their greatest capacity.
And I have a question from Mike McKinnon from KUSI. What are the suicide numbers for April 2020, and how do they compare to April 2019?
Well, the County of San Diego Department of Medical Examiners publishes a one-pager that compares suicides across several fiscal years from fiscal year 15-16 through April of this fiscal year in 1920. And and I'll give you both March and April, last March for fiscal year 18-19, there were 44 suicides. And for this year in March, 39. And likewise, for April of last year, there were 31 suicides. And for April this year, there is 28. Now, keep in mind that for this fiscal year 1920, many of the cases that are suspect suicides will remain open and under investigation until they are closed. So these data are, for the fiscal year 1920, are preliminary.
All right, thank you, Dr. Wooten.
Okay.
This last question we have is dealing with vacation rentals, and Supervisor Fletcher is going to respond.
Yes, this is a little bit more clarification about beach rentals. Is there any talk of putting a moratorium on these types of rentals while we deal with the pandemic? And this is from Rachel from 10 News.
Yeah, so the notion of a vacation rental, short-term vacation rental, all of those types of entities are encapsulated in the same as hotels and hospitality in that sector, which is essentially for essential workers, it is okay, or for an effort that is specifically tied towards aiding the COVID response and recovery, maybe efforts around We're putting homeless individuals or public health at-risk folks in motel rooms. So any of those types of rentals, vacation rentals, short-term vacation rentals, or hospitality industry rentals are appropriate and available to be open if and only if they're housing essential workers or if they are directly tied to the COVID response efforts. One other point of clarification too on the face coverings. The face covering when you are within 6 feet of someone else is a shell wear. And so if individuals are carrying it, then when they get within 6 feet of someone else, they are required to put it on and wear it. Thank you.
Well, that wraps it up for today as far as questions from the media. I want to end on a positive note. Earlier today, I joined Mayor Faulkner over at the Rock Church, and some of you may remember that earlier, a couple of weeks ago, we talked about the Rock Church and some of the other churches associated with them getting together to re-sew or reattach new bands on facial coverings. Those bands, we got a shipment that apparently had some deteriorated bands, and so through their efforts, they, over the last 7 weeks, have had more than 4,000 volunteers fixing damaged masks that we had received. And I want to thank Pastor Miles McPherson and all of his volunteers for this incredible effort that they've had. There's about 300,000 masks that they have in the process of completing by the end of this week. And as it just kind of demonstrates that we're all in this together, and we have everybody working together. And I want to thank them and all the members of the church and the other churches who helped make sure that those masks will be usable. Well, that's it for today. We'll be back here tomorrow at 2:30. And again, remember to stay in place, maintain space, and cover your face. Thank you.